In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover, and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Coronaviruses are a family of viruses that range from the common cold to MERS coronavirus, which is Middle East Respiratory Syndrome coronavirus, and SARS, Severe Acute Respiratory Syndrome coronavirus. Coronaviruses are circulating in animals, and some of these coronaviruses have the capability of transmitting between animals and humans. We call that a spillover event. Coronaviruses typically cause respiratory symptoms, so we recommend basic hand hygiene, such as washing your hands with soap and water, and respiratory hygiene, such as when you sneeze, sneezing into your elbow. Ways to protect yourself against a potential animal source would be to avoid unnecessary, unprotected contact with live animals, and to make sure that you wash your hands thoroughly after contact with an animal, and also to make sure that your meat is cooked thoroughly before consuming. There are no specific treatments for coronaviruses, but symptoms can be treated.
This virus, called 2019 nCoV, is new and we are still learning about it. From what we know now, it can make some people a little sick with a slight runny nose. Other people get more sick and can have difficulty breathing and develop pneumonia. Some people get very sick and need to be hospitalized. Among those, unfortunately, some have died. While we still need to learn more about how the disease affects people, thus far, most of those that died had other underlying health issues. This information will change as we learn more about this disease. WHO will continue to provide updates as more information becomes available. If you need more information on the new coronavirus, check the WHO website at who.int. There are several measures you can adopt to protect yourself and others from getting the new coronavirus. Frequently clean your hands by using an alcohol-based hand rub product like a gel, or wash your hands with soap and water. When coughing and sneezing, cover your mouth and nose with flexed elbow like this, or use a tissue If you use a tissue, discard it immediately into a closed bin. Avoid close contact with anyone that has fever and cough. And if you have fever, cough, and difficulty breathing, seek medical care early and share information about any recent travels with your healthcare provider. If you just have mild respiratory symptoms and no specific travel history, carefully follow the precautions I just explained and make sure you stay home until recovery. If you need more information on how to protect yourself from the new coronavirus, check the WHO website at who.int.
If you decide to wear a medical mask which is pleated and flat like this one, it is important to wear and discard it correctly. Otherwise, instead of protecting you, the mask becomes a source of infection because of the germs that may stay on it. To wear it correctly, you should locate the metal strip at the top of the mask, place over your nose bridge, secure the elastics around your ears or tie the strings behind your head. Make sure it covers your nose, mouth, and chin. While in use, do not touch the front of your mask. To remove the mask, take the elastics from around your ears or untie the strings behind your head. Do not touch the front of the mask as it may be contaminated. Remove the mask and discard in a closed bin. Cleanse your hands with alcohol hand rub or soap and water. Hand hygiene should be done if you accidentally touch the front of your mask while wearing it. If your mask becomes damp or humid, replace it with a new dry mask. Never reuse single-use masks and discard them immediately into closed bins after each use. For more information on mask use and the new coronavirus, check WHO website at who.int. Medical masks like this one cannot protect against the new coronavirus when used alone. When you wear them, you must combine with hand hygiene and other preventive measures. WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear masks because there is no evidence that they protect people who are not sick. However, if you are healthy, but you are taking care of a person who may be infected with the new coronavirus, then you should wear a mask whenever you are in the same room with that person. And remember, if you choose to wear a mask, use it and discard it properly and clean your hands with alcohol hand rub or soap and water. For more information on mask use, other preventive measures, and the new coronavirus, check WHO website at who.int. Thank you.
Hello, my name is Nika Alexander. I'm a communications person here at the World Health Organization. Today we're going to talk about clinical management for people who are sick with the new coronavirus, with the novel coronavirus. I won't be doing most of the speaking. It will be my colleague, Dr. Janet Diaz. Janet, do you want to introduce yourself?
Hello, everyone. My name is Janet Diaz. I'm the team lead for clinical management at the WHO Emergency Program.
And so clinical management means how you care for a patient who's sick, right? It's the treatment. So this could be a very specific kind of conversation we're having today for healthcare workers, but we want this to be interesting both for healthcare workers and for the general public. So hopefully it will be of interest to anybody who wants to learn more about this disease, but it really is more about that specific topic of how patients are cared for. So this is a new disease. I want to timestamp this a little bit. We're recording this on the 1st of February. At the moment, there are 12,000 cases of the disease in China, 12,000 cases in China, and 130 cases in 23 other countries. So it really is centered in China at the moment, but people are working together to learn more. So how do you learn more about a disease which at this point is 1 month old? We've only known about it for 1 month.
Well, it's a challenging situation, but with the WHO, we have established a global clinical network. So we are in touch with at least twice a week, but more so by email, on a large teleconference calls with clinicians that are actually caring for the patients, clinicians from China, from Wuhan, from Shanghai, as well as clinicians from France and the US and the other countries that have been caring for patients. And it's an opportunity for everyone to share what it's like to care for those patients, what they're doing, what they're presenting with, what their symptoms are, what their complications are.
And so what do we know? What have you learned so far?
So it seems that at large that the disease leads to a mild illness. So most patients are mildly ill, which means they have maybe a fever, cough, sore throat, muscle aches. But there is a percentage that does get severely ill. We think it's about 20%, but we will see those patients go on to develop severe pneumonia. They can also develop dehydration, respiratory failure, which means that they would need a breathing machine to help them continue breathing, and there have been deaths.
At the moment, what we understand from Chinese authorities is about 2% of the people for which they have information, 2% of the patients in China have died. Is that about right?
Yes.
Okay, so that, again, timestamp for this time. This is 1 month after we've known about the disease, and information may change and evolve as time goes on.
Exactly. I mean, I think for those, there's patients that remain in hospital, so we have to see what their outcomes will be after being in the hospital.
So that you just summarized what we do know. So for most people, it's a mild disease, about 20% severe, and about 2% have died. What do you not know? What are the questions you're trying to get answers on?
Well, we also have an idea that those that have died with disease tend to be of older age and have chronic other medical conditions, such as diabetes. But we would like to have a better understanding of that, so that's what we need to know. So truly, what are the risk factors for severe disease? What are the risk factors for death? We also need to know what treatments would work, what antiviral treatments would work for this novel coronavirus.
At the moment, there is no specific treatment. There's not an existing medication that you can pull off the shelves and say this works for people who are sick with nCoV, with the new coronavirus.
So with this new coronavirus, we have no known effective antiviral therapies. There are some that have potential, we think may work, but we have no known effective antiviral therapies.
So what do you do? What are these doctors that you're speaking with in China and elsewhere, how are they treating these patients?
So because the patients that are mild at large, that they have self-limiting disease, which means they get better with some time, so they get treated with symptomatic treatments such as paracetamol for fevers. Or for those that get sick in hospital, then they require supportive care treatment. So this may be on the hospital ward or in the intensive care ward. That would mean if you have pneumonia and you need oxygen therapy, you get oxygen therapy. If you need IV fluid therapy, you get intravenous fluid therapy. If you are suspected to have an infection, a co-infection, so in addition to the novel coronavirus, a bacterial infection, which can happen, then we give you antibiotics. And if you develop respiratory failure, you go on mechanical ventilation.
So I just want to be really clear on this antibiotic side, because this is a virus. You can't treat viruses with antibiotics. But as you said, if the person has this virus and a bacteria, you give them the antibiotics to treat the bacteria.
Exactly.
Okay. What are we doing then to find a specific treatment?
So WHO is working nonstop with global experts. We have the R&D blueprint, which is accelerating research during outbreaks, and they have assembled multiple also meetings, teleconference meetings with global experts on research. And there are two main outputs that will come out of that. One is the prioritization of potential therapeutics. So based on the evidence, what therapeutics that are out there or in pipeline, in development, should we use in a clinical trial? Yeah, focus on, like use to treat patients. And the second aspect is a development of a master clinical trial protocol, which is the best way to test new therapeutics for efficacy and safety.
So for a general public, I just want to simplify the language a little bit there. You said WHO has an R&D blueprint. It's like a group that works on research and development, if that sounds right.
Yes.
And then what is a clinical trial in this context? I think before I came to WHO, I thought a clinical trial was about chemicals and pipettes and whatnot, but it's actually establishing a way of some patients treated with this, some patients treated with that, and then comparing their outcomes, or how does a clinical trial work in this context?
Yeah, I think what you've described is true. So what we are doing with the global experts is developing a master protocol which has clear protocol on how you use these new therapeutics, because they need to be tested. Patients will get randomized into one treatment group or another treatment group, depending on what the final protocol determines. And
that's about how it works. And consent's always a question people wonder about as
Oh,
well.
of
If
course.
someone's in a trial, do they give their agreement to be part of that? But these trials are always reviewed for ethics, and there's a consent.
Oh yeah, so
component as well for
any
them as
clinical trial has informed consent involved in ethics approval at the country level. So we're in the early phases, so we're developing the master trial protocol with global experts.
Okay, that's the stage we're at now. We're going to wrap up soon, but what would be your advice, Dr. Diaz, for healthcare workers who are watching and who are interested and want to know what to do if there's a patient or they think somebody might be a patient with this disease in their healthcare setting?
So I think to start off with, it's important to get familiarized with the WHO website. It has a lot of useful technical guidance documents to inform about the disease and how to treat the disease and how to prevent the spread of disease. For those of you that are actually healthcare workers or if you're a patient, I think the most important thing is to recognize a potential person that may have novel coronavirus. We have the case definitions on the website, so you can read those and you post those in the clinic, and then if you suspect someone may have the virus, then quick action is to isolate and prevent further spread of the virus, and we have guidelines on that. And then if someone is very sick with the virus, with the severe complications, then initiate supportive care treatments like I described before.
So this is for healthcare workers. We're not saying members of the public should be identifying people who are sick and isolating. This is really for health workers.
I think for members of the public, if you develop a fever, cough, or shortness of breath, then you must seek medical care. And, advise if you have traveled to the affected areas.
Yeah. Thank you. So that's, at the moment, as we said, the 1st of February, when we're recording this with the knowledge we have now, the outbreak is mostly in China. The vast majority of cases are in China. The cases in other countries have a travel history or link to China, again, mostly. And as Dr. Diaz said, for the focus is really on people in China to listen to what the national health authorities are saying and when you should go to a healthcare center versus staying at home, because sometimes the disease is mild. And then for people elsewhere in the world, fever, cough, and difficulty breathing, you should seek medical advice on what you should do next. Is that a good summary?
Yes.
And you mentioned that more information can be found. That's at who.int. We're improving the website, adding more information as we go along, but there is information for if you're traveling, protective advice for yourself, and there's a lot of guidelines for ministries of health and health workers and so on. So thank you so much for watching today, and thank you for being with us. One thing, actually, one more I should add is that this is a more of a general kind of discussion we had, but we're also developing, WHO's developing courses and has more detailed information really for healthcare workers that is more specific and really meant for you and to help you in your work. Thank you very much, and check back often for more information. Bye-bye. Thanks again.
Thank you.
The new coronavirus can spread through respiratory droplets, which are liquids that may come out when we cough or sneeze. For this reason, it's very important to avoid close contact with anyone who has fever and cough or other respiratory symptoms. In practical terms, we recommend keeping at least 1 meter distance from a sick person. Also, you should avoid shaking hands, hugging, or kissing people with these symptoms. If you need to take care of a person who has fever, cough, and difficult breathing, do not forget to wear a mask and, in particular, to practice hand hygiene. If you need more information on how to protect yourself from the new coronavirus, check the WHO website at who.int.